Hello, everyone, and welcome to another edition of Clock Talk with founder and owner, Dr. Greg Brannon of Optimal Bio. How are you today?
Fantastic, Jim.
Congratulations on the book Restore.
Thank you very much.
Obviously, we're going to be here today and talk about primarily chapter 3, but also congratulations on being the Amazon bestseller gold medallion.
Yep. Again, there's a complete team effort.
With this wonderful award you have, are you being treated any differently at home right now?
Oh, never.
Okay.
Not even at work.
So let's talk a little bit about chapter 3, understanding your hormones, the energy sources of your body.
Mm-hmm.
So let's talk about energy. How does the body produce energy?
Yeah. One of our episodes a long time ago, we talked about metabolism. And there's a thing in our body called ATP. It's basically the currency of our body. And when we eat food, it's got to convert and become the structure at the same time, you need energy to put it together. So one thing called the Krebs cycle, this kind of stuff. Bottom line is sugar gives you roughly 2 ATP. Fat molecules gives you around 30, 38 molecules. So the bottom line is you want to keep these substrates used for the purposes. You can actually get energy from protein too. That's the last source you want to use. It's called gluconeogenesis because you want to use protein to build the bones, build the brain, build the muscle. But that's what it is. That's what it's all about. And the key thing is this, Jim. The energy source to turn on this transcription and translation, the actual energy source that turns that cell on, there's two of them. There's thyroid and testosterone. And that's what this is about. Testosterone is the fuel to allow your body to make what it needs.
So you're quoted in this book, I think it's, do we lose hormones as we age, or do we age because we lose hormones?
That was my question. And again, I'd like to be confident I know the answer. My gut is I believe we age at a quicker rate because we lose hormones. That's my guess. Again, obviously, the theory of aging is if I had that, I'd be a Nobel Prize winner. That's not going to happen. This is in my mind because I'm seeing chronic diseases at a much earlier rate. So we're doing something to age faster. And then we may live, we're living about 3 years less than we used to in America, but you're living with chronic diseases. And there's sequelae to that. You become sedentary, you increase diabetes, you increase dementia, all these things. Living is, I believe we could live and not exist. And I believe we could live healthy and live a fruitful life and a quality. I believe quality and longevity can go together.
I think the industry over time, I think when it started, it was all about longevity. Longevity, you saw pictures of, 75-year-old face with a 20-year-old body, and it was live forever, take testosterone. Do you think that brand and that market has changed now more towards health, or is that just Optimal Bio doing that?
I think, I know we are, and again, I'm not anti-longevity, but I think people miss the idea that I can be bigger, stronger, faster, and live less. It's just the opposite. You can be strong, bigger, stronger, faster, and live longer. The longevity curve goes with the health curve. So if you are not chronically sick, diabetes increases heart attack. Chronically sick people get one of the highest risk factors for mortality is waist circumference. A man over 40, a woman over 36 inches. So our metabolic health leads to our diseases, which leads to our aging. So to me, the whole idea is let's be as healthy as we can. And there's nothing wrong with living longer. I mean, Dr. T's book, I Live, talks about that data. I think it's important, but I want, again, I'm not the kind of person that says you should not live long if you don't have quality. I'm not that. I'm a huge believer in life. God starts the heart, God stops the heart. I'm a passionate on life at both ends of the spectrum. But I think we're getting a faster rate of disease processes because we're missing the core, how the body works.
The pharmaceutical industry obviously got into the hormone business years and years ago. And I think in a previous chapter, we talked about the synthetic versus the bioidentical. But you mentioned sugar earlier, and obviously diabetes is skyrocketing in this country.
Mm-hmm.
Can hormones play a factor in reducing diabetes?
Oh, Jim, I'm going to give you a story.
But the reason why I mentioned synthetics, I want you to answer the question, but also compare it with synthetic to bioidentical.
Okay, and important. First off, synthetic or non-human. There's a great book out of Belgium called Sex Hormones and Neurodegenerative Diseases. And it talked through the benefits of higher testosterone, bioidentical and endogenous. Those people higher at testosterone that's endogenous, your body makes it, or the hormone level or the hormone you give you looks just like it. You have less cardiovascular disease, less diabetes. In fact, if you're on bioidentical hormones, you decrease your hemoglobin A1C by 17.6%. It actually, testosterone makes the insulin receptor more sensitive, so less insulin to do more job. Example, this man, he's 66 years of age. He's on an insulin pump. His testosterone is in the 150, but 200 range for normal for his age, 220, 260. And this was his first time he'd been on pellets. And he came for a second pellet. And he was giddy as all can be. He goes, my insulin demand decreased by 50%.
50?
50%. He was using 100 units a day. He's using 50 units a day. And he goes, my waist, I lost 17 pounds. My waist lost 2 inches. My endocrinologist said, he asked about testosterone. He goes, that has no bearing. You're like, I got, the data's everywhere. So it's like, well, if you were the endocrinologist, you go, wow, my patient's using half the insulin. He's lost 17 pounds. Hemoglobin AC went down 15, 16%. And you don't ask why? It's frustrating, Jim. But the answer is, this is it. So glucose and fat are major energy sources for this body to run. The problem is you have excess fat. Excess sugar is stored in our body, in our liver and our muscle as glycogen. When that glycogen storage gets filled, it becomes adipose. We've talked one time on our podcast on brown fat and white fat. And there's so much mitochondria in it and that kind of stuff. And the problem is that when you start backing up metabolically, the first organs that get fatty are liver and pancreas. And they're the same ones that make the enzymes that make the hormones that make the body work. And very interesting, was never a case documented in America to 1980 on fatty liver on non-alcoholics till 1980. Funny thing, 3 years after the food pyramid. Now between 40 and 70% of Americans have fatty liver. It's a metabolic disease, Jim. So if you go on testosterone and fast, it'll go away. We did a podcast a few months ago on the Randall cycle, Dr. Mercola talking about that. So I believe, and he's very clear, I'm a huge faster. I'm a big believer in keto. I'm a big believer in all that stuff. But once you become fat, energy adaptable, and now you have got rid of insulin resistance, it appears that to be more efficient, you should add some sugar back. And he talks about using simple sugar first in the sense of out of fruit. Okay. That's called the Randall cycle. But the bottom line is body, again, is amazingly made, but it knows how to survive, Jim. But I don't want to survive, I want to thrive.
So then, just from a metabolic standpoint, with the bioidentical treatment with diabetes, what's actually happening inside the body?
Okay, so the testosterone literally makes the insulin receptor that gets sensitized by the insulin more sensitive. So therefore, the receptor can do its job by getting glucose out of its body. Insulin is not bad. It's vital without life, for life. It's having too much. Remember, type 1 diabetes is your pancreas makes no insulin. Type 2, so as Jason Fung talks about, we give you more insulin. It's still not doing stuff. So it must be a root cause of this. And I put in their chapter, this is important, on that book, chapter 10 of that book, Sex Hormones and Neurodegenerative Diseases. He breaks down the studies between the 3 categories of synthetic non-human hormones. Number 1's called an ester. It's a molecule an ester is a carbon with 2 bonds to an oxygen. And you have the testosterone molecule, which is the active molecules, just like bioidentical, but attached this long carbon chain, which allows it to sit in the muscle and be like a depot. Okay. That's the most common: cyprinate, ethionate, and propionate. Number 2 category is they take the structure, testosterone, and change it to 19-nortestosterone. And then they have one called, 3 was called 17 alkylation. The 17 carbon, they have that's another long carbon chain to allow you to take it orally. And even the one that they do orally goes to liver first, but there's a new one out there called undecanate that's absorbed by the lymphatic system, so bypass the liver. But the half-life is only 21 days. So, but the problem, all 3 of those categories, Jim, do something very, very interesting. They increase neurons dying off faster. And there's an association with a higher Alzheimer rate. All right. So this is where you may be healthier for a shorter period of time, bigger muscle, bigger strength, because they're 1,000 times stronger, but there's sequelae. The bioidentical one actually makes more brain form, called neuroplasticity, and actually makes the brain get tighter together, called the synapses, so the brain can commute better. Testosterone converting estrogen actually works in the synapse, and there's a ton of papers on that data. In fact, for TBI, the treatment is testosterone with growth hormone, is showing the data on that to make the brain talk. I can't stress that benefit.
So obviously, if somebody's on insulin for diabetes, if you were, I know we're not diabetic doctors and endocrinologists, but you would think that these endocrinologists would talk to them about testing their testosterone
Jim,
to see
it
whether they're at.
decreases the incidence of diabetes by 250%. 250%. Okay. So yes, why is not the whole, Dr. Morgenthaler, he's a Harvard urologist, writes, if you had a drug he lists all these things, you would say, where is it? And the drug is, your body makes it. It's testosterone. And that's the thing we're missing. We're missing how amazing this body is. And again, I don't have the answer. I'm not saying it's bad motives, but the bottom line is, I believe the onus again on drugs is that if it's a different structure, we're talking the structure of it, the actual, where the carbons are, the hydrogens are, the nitrogens are, the 3D model of it, they got to tell me that the one your body makes is inferior to the one they get. Now, again, the ones they make may be stronger, maybe do things, but there's problems with that. When the body's not recognized the same, it doesn't know how to utilize it the same, metabolize the same, or eliminate the same. And that's where the side effects come in.
We have patients, obviously, that I think have come to Optimal Bio that were on synthetics. And do you count shots as synthetics also?
Oh, yes. Again, Cyprinate. Okay. Again, people that sell Cyprinate, Jim, will say it's bioidentical because the active metabolite is bioidentical. They're correct. But because they had to cleave off this long chain, it does not act the way a pellet does because the half-life is 3 days. It goes up and down.
Right. Obviously, through education, through speaking with you, through looking at the website, listening to podcasts, et cetera, but people don't have access to that information and they're watching today. Right. What do you tell them in reference to weaning yourself off synthetics and coming on to BHRT?
Well, I think that we've done enough, Jim. We have a lot of men that come in on shots who convert over. I can't think probably less than 1% go back to shots.
Right.
Because they just feel better, and it's very simple. You get placed twice a year instead of twice a week. It's a this needle. We spend a lot of time educating the science. I think one time we spent a whiteboard a couple months ago, talking about the whole idea of the aromatase. And that's crucially important because the side effects of anabolic steroids are because the aromatase is not in sync with the testosterone. So we spend time educating all that, and it's important. But again, I want to be very, 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 very clear. Greg Brannon would be on Cyprinate tomorrow if I never heard of pellets. Greg Brannon would be on estrogen cream. I wouldn't use patches. Patches actually has antifreeze in it as a dispersing agent. Androgel has increased blood clots. There is a pellet called Testapel that is bioidentical testosterone, bioidentical stearic acid, but there's a thing called polyvinyl propionate in it. 2 milligrams of it. The EPA over here says don't put in contact with skin, and yet the FDA approved it. So why? It could become patentable. So I would not use that. I would go bioidentical cream first, even though 40% of men can't absorb it. You can never get high enough. But the pellets, I got a timeline in the book. The pellet of 1931 was when testosterone was isolated. I think it was 1940 estrogen was. But from 1935 was the very first study ever given where human beings got hormone replacement therapy. It was on women who got pellets who had hysterectomies. 1937 was the first study on men. We have a timeline. We have a data. There's been over 16,000 articles on this since 1935. And there's no side effects ever been shown, or no country has ever pulled it off the market of the bioidentical version.
Mm-hmm. If you're on the synthetics, do you have to wean yourself off and wait?
Our algorithm, nope. I know it's out of your body in 3 days.
Okay.
I don't want people to feel miserable. We have an algorithm that actually applies and gives them their dose where they're going to be at, and then we adjust the dose in a month after that.
takeaway for the reader on this chapter?
It's biochemistry. It's applied biochemistry. And again, back to this, it sounds simple. You cannot run your car without gasoline. And this is what it's all about. And the purest form is the one your body makes.
And I love that analogy too, thinking, I mean, everything we do, we try to fix except for the human body sometimes. So keep that in the back of your mind when you're thinking about hormone replacement
And
therapy.
Jim, we've done, I think, about 60,000 placements in 12 years. Donovich at 1.2 million. The data's there.
Another great edition of Clock Talk. Get the book Restore. Thank you.
Thank you.